Hi, everyone. Welcome back to the Breast Cancer Podcast. Hello, I'm your host, Dr. Deepa Halaharvi, a fellowship trained breast surgeon, and also happen to be a breast cancer survivor, thriver, and a warrior, living my best life. As you know, breast cancer affects millions worldwide, touching lives in a profound ways. Whether you're someone facing a diagnosis or a supporter seeking information or just eager to learn more, this podcast aims to be a beacon of understanding, hope, and empowerment. I'm here to talk about all things breast cancer, from surgery to survivorship, as well as high risk for breast cancer to metastatic breast cancer. My goal is to provide you with reliable information, share inspiring narratives, and foster a supportive community. I know firsthand the challenges breast cancer diagnosis brings. Throughout this podcast, I will give you strategies to handle difficulties that arise from cancer diagnosis. We'll have insightful conversations with medical experts, researchers, survivors, caregivers, and advocates. I will tackle topics that impact our lives as cancer survivors. My goal is to educate you and empower you to live your best life. I definitely have. Well, let's get started. All right. Hi, everyone. Welcome back to the Breast Cancer Podcast. I have the amazing Jennifer Skinnell, the author and blogger, and you're going to find out a lot more about her. And my bestie, my breastie, Dr. Mark Cripe, who is a breast and melanoma surgeon. We both work together here in Columbus, Ohio. And we have a great story for you today and lots of great take-home messages from this. And so I hope you stay with us. So I want to welcome Jennifer Skinnell. She is an author of 7 books. You help publish six more with other people. She is a daughter, a mother, a wife. She is a blogger. Oh, and a grandmother. That's right. And also a breast cancer survivor. And today we're going to be talking about this book. It's called Don't Wait, or Full-Time RV Journey Through Breast Cancer. She has lots of great tips and pearls for people who go through adversities, and she has done it beautifully. And I can't wait for you guys to listen to her story. So Jennifer, take it away from here.
Okay. I don't know where to start, but
Yeah.
the reason I wrote the book was when I was diagnosed, I needed a why. Not that I was feeling sad that I was diagnosed. I kind of knew it was coming, but I needed a why for why it happened to me. And I wanted it to be a good why. And at 3:30 in the morning, 2 weeks after surgery, I woke up with this book in my head. And I sat right then and wrote the intro. And then I went to his office later in the day and asked him if he thought it would be a good idea for me to write the book. And that's what started this whole book journey.
Yeah. And you had already written 6 books prior to that? Okay. So
Yes.
You're not new to writing books?
No.
Yeah.
No. I've been an author since 2016.
Okay.
Before that, I was a lot of other jobs.
Yeah.
But writing is kind of my passion. And
Yeah. So I wanted to find out, where do you call home, or what place do you call home?
So we are, as he found out 5 minutes after meeting me, we are residents of Florida, but our Texas mailing address, we have a Texas mailing address.
Okay.
But all of our medical stuff is here in Ohio, in
Okay.
Columbus, in Hilliard, actually. And so we used to live in Northern Virginia. We sold our house in 2020 after 30 some years and went full time because we used to RV with our children, and then we got out of it in 2008 when our kids were in high school and nobody wanted to go anymore. And so we sold everything. And then in 2018, we decided, I think we want to get back into it. Just ease our way into it with a smaller rig and a smaller truck. And we, over the course of a year, moved from like 3 trucks and giant to a 41-foot fifth wheel, and did 2 months in Florida and decided, I think we want to do this full time. And so we sold, we went back in 2019 to Northern Virginia, started downsizing. But before we bought the 3rd rig, I skipped a part, but we had the smaller rig when we went in 2019. And then we came home and we said, we really want to do this full time. And I said, we need something bigger. We can't do, it was a 30-foot travel trailer and there was no way, there was no storage. And so we decided my husband was like, let's just wait until 2020. And I said, no, I think we shouldn't wait.
Yeah.
There's something just telling me. And whenever I tell him we shouldn't wait, he gets it. And I was glad we didn't, because in 2020, COVID hit. You couldn't find an RV, you couldn't find a truck. So we were already set with what we had. But the whole don't wait premise came from people that we knew who were waiting to do whatever it was they wanted
Yeah.
to do in their life. And by the time they got around to it, it was too late.
Yeah. Yeah.
Mm.
And Dr. Cripe and I see this all the time with our patients. Women are busy taking care of the kids, then husbands and working and parents, and sometimes they don't take care of themselves.
Mhm.
And it's easy to say, the kids come first, or the husband comes first, or the parents come first. I have actually been one of those people myself in the
Mhm.
past. So I know from experience, when I was taking care of my dad and going through medical school, taking care of my kids, I was not taking care of myself. So this book resonates very well with me. I'm a breast cancer surgeon who also put off getting my own mammogram. So when I was reading it, it hit home for me. And I'm sure this message is going to resonate with so many other women
Mhm.
in the community. So I know reading it, you've decided to be in an RV prior to your breast cancer diagnosis. Was finding your breast cancer or finding a place to go for treatment, was that difficult? And how did you decide that process?
So that part was not difficult. What was difficult was making sure that we were here in Ohio for me to get that yearly mammogram.
Mhm.
And I got one in September of 22. And we left to go on our adventures. And I got a call that they wanted to do a follow-up. Well, by then I was already in Pennsylvania. So then it took me 2 weeks to find another place. They wanted the follow-up of the mammogram and an ultrasound. We ended up back in Northern Virginia, where we were planning to be anyway, to visit our son. And that's where I ended up getting the follow-up, but they only did the mammogram. And they said, there's nothing there, but I'm like, you're not gonna do the ultrasound? And they said, no, we don't
Yeah.
need to. But in my head, I kept all the way along
Yeah.
thinking, something's not right. And so in 23, when I would have had my regular September mammogram, we were supposed to be at Glacier National Park. And I knew there wasn't a mammogram place there. So I called my insurance and I said, can I get it earlier? Do I have to wait 365 or can I do it earlier? And they said, you can do it whenever you want. So I got it May 11th at Ohio Health when I had my regular physical. And then I got the call on May 12th that I needed to call this number to do another follow-up.
Yeah.
And that led me to that following Monday, this guy.
Yeah. So what did you think, Dr. Cripe, when you first met him?
Within 5 minutes of meeting him, I knew that he was going to be my surgeon.
Yeah.
I mean, he quoted Friends, so
Right.
anybody that can quote Friends.
That's a funny story in the book. I love it. Yeah.
I know. I saw. So Friends happens to be one of my favorite
Yeah.
shows growing up. I mean, in college, that's what we watched. But so when he was talking about the third nipple, I think,
Yeah,
right? Like
yeah.
the referencing to Chandler.
Uh-huh. So I
And
was
it's
like,
interesting that I'm from Elkhart, Indiana,
right.
which is the RV capital of the world.
I had no
and then-
idea you were from.
Yeah, and you
Elkhart.
guys are in an RV. So it's interesting that my parents' friends and at our church, we had a lot of people growing up that would be either not necessarily living in an RV, but do a lot of RV camping. So they often went off and had big RVs and would go have fun. And even we had a church camp out every year. So everyone would bring their RVs. So when you're talking about, okay, we sold everything
Mhm.
and now we're kind of in this nomadic lifestyle. I'm like, yeah, that again kind of resonates with me and growing up
Right.
in Elkhart. So that totally
Wow.
makes sense.
Yeah,
We're all interconnected somehow, right?
Yes.
we are. Mhm.
So what was special about Dr. Cripe when you first met him that was different from other doctors?
All right,
that
now I
you
feel awkward.
have?
Well, I think, a lot of the doctor-patient relationship is so important.
Yeah.
Especially going through something like this. And he just made us feel really relaxed. And I never felt nervous. I didn't feel awkward, even my daughter, she was in there with us, Emily, because I had her come and take notes. Because I knew I wouldn't remember, and I knew my husband couldn't remember anything. And so she even said how relaxed he was.
Yeah. I think there's 2 points I want to make here. One is, taking someone with you as you go to see a
Mhm.
doctor, and we only remember 10% to 15% of what the doctor tells you. So it's always important to take that other person who will then take notes and keep track of what the doctor is saying. So because you're just being hit by a train, being
Mhm.
told it's, abnormal mammogram in your situation, I imagine was the first time you met him,
Right.
correct?
Right,
Yeah.
that day,
Yeah.
yes.
Yeah. So lots of things are going through your head. And I know Dr. Cripe really well. He's trained me in my residency and fellowship, so I know him, and we all want to be like him. He is a fantastic, phenomenal surgeon in the OR, very gifted, but also I think the bedside manner is something that very rarely that you see a physician and surgeon to have that. But I think going back to your point of connecting with a surgeon in the time where it's the most scariest time for you, I think it's hard. It's hard as a woman, as a man too. I imagine it's the same thing. But for him to put you at ease, I think that's really good for us to take, to remember patients are going through so much when you first meet them.
Mhm.
And we may have our own things going on back of your head, but that is the day that is going to be patient's life is going to be changed, right? So it's a really good point for if someone is watching that's in medicine, whether you're a nurse or a doctor, it's important to know that what's going on in that person's life. It can be really important. And, some people may not have a job, may not have family support, may not be financially, successful. So to take the whole picture into consideration, I think it's important. And Dr. Cripe does that really well.
And he actually, within, like I said, within 5 to 10 minutes of meeting us, he knew our situation.
Yeah.
He knew, oh, they live in an RV, they move around the country. And I told him, I said, I'm going to the Rose Bowl parade at the end of the year. So that was like the most important thing to me.
Yeah.
And then when he called me later, so when we discussed when I was going to have surgery, the date, he asked me, when would I want it? And I said, well, I'm going to the beach with my family and I'm getting a family beach picture taken. And that's the most important thing to me right now. And he wrote that in the notes.
Yeah.
And that to me was like, okay, he gets it.
Yeah.
He wrote it in my notes.
And I think that's important when, talking to someone is to find out what their goals are. So like for you said, okay, at the end of the summer, I'm going to the beach. And it wasn't like, I want to go to the beach. It's like, I'm going to the beach. I was like making sure like, what does that person want and what are their goals? And sometimes people don't know what their goals are, but trying to tease that out of them to say, okay, what's most important to you right now? So I think that's an important thing. I always try to ask people, just because we all have busy lives and we're not running around the country all the time, but we definitely have lots of things planned in our schedules, and just making sure, okay, what's the most important thing and what are things that we can move to the side?
Yeah. So we moved a lot to the side.
Yes.
Yeah.
Yeah.
We canceled 7 states.
Your trip.
my
Yeah,
goodness,
big
wow.
trip, right?
Yes, we were planning to go like all across the northern part of the country, like I said, Glacier in September, and like all through Utah and everything. And so my husband is our trip planner. And once we realized, okay, this is when I'm going to have surgery. We don't know about chemo yet. So let's cancel up until this point. So we canceled up to November 7th when we were in Sedona. And then we decided, okay, once we figured out that I didn't need chemo and I was allowed to have my sangria to celebrate, and we said, okay, well then we'll just stay here until my 3-month checkup. And we were at a campground at Alton, which is not that far from here. And she said, you can stay as long as you need to. And so it was an open-ended reservation, which was important. That's another thing you have to think about is, we had to figure out where we were going to stay.
Yeah.
And so then we said, okay, October 23rd, we'll leave. And so that's what we did. We left and kind of winged it, but we went to, picked up some of the places that we wanted to do before, but because of COVID, we couldn't. Like we went to St. Louis and did the Arch. And then we went to Oklahoma City and did the Federal Murrah Building tour. And then we went to Las Cruces and just hung out for like a week and a half and enjoyed the warm weather.
Yeah.
Because it was cold
That's
here.
good.
Yeah. So navigating all of this during COVID, how difficult was that?
That was tricky because when everything shut down, we were in Florida.
Okay.
And we had been, I don't even know how we never got COVID because we were in Disney World like 4 times the week
Wow.
before.
Yeah.
Like that Friday night, we were at Epcot with everybody else.
Yeah.
And like ELO was playing, we had
Yeah.
no idea. And we were, enjoying an ELO concert for free in Disney World. And then
Wow.
like a week later, we had just gotten our Florida residency set up and the DMV stuff done. And like 3 days later, there was a mass exodus out of Florida
Oh, wow.
because all the Canadians had to get home. They had a
Yeah.
week.
Wow.
If they didn't get back to Canada, they were stuck here with no health insurance. So
Yeah.
it was crazy. And then trying to find a place where we could stay until we could finally get back to the house, and selling the house during COVID, that was fun too.
Yeah. I still cannot believe all the things that you have been through to do what you want to do is to live this simple life, which I imagine brings you a lot of peace and
Yes.
calmness, right?
Yes.
And so I'm just very fascinated, having not had exposure to that type of lifestyle. I'm just like, so many things were going through my head. Like, how many outfits does she have?
No.
How often
And
does
this
she
much
shower?
closet space.
Like, I mean, how
How
many
many
shoes?
shoes?
Like,
Yeah.
how
How many
shoes?
purses?
I know. I'm
Wow.
just like, gosh, she must be very easy to please.
I had to like really downsize
Yeah,
a lot.
yeah,
Yeah.
yeah.
Focusing on like the medical aspect of, so I find that fascinating, just thinking through everything when you look at lab, x-ray, like when are you going to have your visits? Like, tell me a little bit about how you set up you talk about your medical home in the
Yeah.
book.
Yes. So we made Hilliard our medical home because our daughter and son-in-law and our grandkids are in Hilliard. And we know eventually that's where we'll end up. And so we said, well, we'll just set everything up here. And because then we come back every year, twice a year, for about 2 months in the spring and then a little bit less in the fall. So if we need follow-ups or whatever, and I line up all of our appointments to do physicals, dermatology,
Mhm.
dentist, eye doctors, all of that. We line it all up for like the beginning of the trip in the spring. And then if we need any follow-ups or whatever, then we have time to do those before we leave. But that's how we do. We have a Google Calendar
Yeah.
that has all of our trips on it and all of our medical appointments. So when my husband's making reservations, he can say, oh, okay.
He
this is
looks
where
at
we're
the
gonna be."
calendar first.
Mhm.
I think even having your lab values. So
Yeah.
like you talk about a little bit in the book that when you went to Pennsylvania for the mammogram, you can get a report faxed over, but they may not have images. So
Yeah.
that's another thing too, where you have to have your images, I would say on a CD, because when we think of it, everybody's like, okay, it's electronic. Everybody can just share that information, and not always true.
Not always true.
And then some people put it on a flash drive, and where we work, we're not allowed to use outside flash drives. So
Yeah.
really it comes down to you need your images on
On
a
a CD.
disc, because if you get it on a disc and then let's say you're injured or go to a hospital or urgent care somewhere, if you have a printout of all your lab values and your imaging on a CD, then they can at least have access to all of that right away. But different than someone here where we just like, okay, it's on my chart.
Right.
It's easy for
Yeah.
pretty much everybody in Columbus land to talk to each other within the medical community, but not when you go elsewhere.
Mhm.
Yeah.
So you really need to have those hard copies, which is a kind of old school thought, but it's like you have to have that with you.
That and prescriptions. Some people
Yeah,
had to write
prescription.
prescription for me.
Yes.
Oh, yeah.
Yeah.
That's
Real
really-
paper and
Real
write it.
paper. I did. I made him do that.
Yep.
Wow.
Because you have to take it somewhere.
That's right. Yeah.
Yeah.
And you have the real paper prescriptions.
I still do. I still
know.
do.
But he had to print it off.
Yeah. Yeah.
Yeah.
And prescriptions, that was another thing that it was a struggle, not so much before cancer, but after, once I was on an anastrozole, because I wanted to make sure I had the same manufacturer.
Company, yeah.
And so as I would go around the country and have to have them filled, I would have to call around to find out who had that manufacturer. And what was really interesting was in Ohio, the pharmacist would give me 3 months, even though he'd written it for 1. When I got to California, they would only give me 1 because that was how it was written. But then when I got to Arizona, she said, I will give you as many as you want. I'll give you like 4 if you want.
Wow.
So that was an interesting thing too. So in the middle of all of this, my husband retired at the end of the year.
Mm.
So now we are on a health share plan. So
Mm.
that's a whole different kind of thing.
Is that like Cobra or something?
No, it's a,
Yeah.
it's a health share. It's called Zion Health Share, and we don't have a specific insurance,
Okay.
but if something catastrophic happens, we pay like $1,000 and then they pick up the
Oh,
rest. kind
wow.
of deal.
Okay. That's good.
You pay into this health share. Well, they have an RX share as well. But then when I started researching it, I found that if I asked him or my other doctor to write it for 365 pills and no refills, I could get an entire year at
Oh,
one
that's right.
time.
Yeah.
Because I wasn't going through an insurance company.
Right. Okay.
So that's how I do my prescriptions now. So I'm good for a whole year.
And there's so many
Wow.
differences
Yeah.
versus if you're living in one place that if
Yeah.
you're traveling around. So a lot of different things that I would never think about
Yeah.
until you started talking like, okay, yeah, this makes sense. And that's where I
Yeah.
think the book is helpful a couple of ways. One is making sure that you don't wait and you enjoy life and you do the things that you want to do. Also, for someone that's kind of nomadic and moving around, whether it be within the US or outside the US, like just how do you focus on your health care, which is another, again, something I wouldn't always think of.
Yeah.
And then people that are living in RVs and just, again, some of the challenges. So a lot of different people can learn
Yeah.
great points from this
Yeah.
book. So I think it's a
Yeah.
great book.
I think so.
Thank you.
And I want to hear a little bit about your breast cancer journey.
So I think mine was, I almost too easy.
So there's no such a thing as
I know
too
there
easy.
isn't, but
Yeah,
to me,
yeah.
because at the same time I was going through it, there was someone else in the RV park.
Yeah.
She was going through cancer that had come back.
Mhm.
And so hers, I would see her and I could see her decline. And I was not, her husband would come back from, because she was at the James and she went into the hospital the day I had surgery.
Hmm.
And 6 weeks later, she was still in the hospital.
Hmm.
And he would come back
Yeah.
to the RV park and his first question was, how are you doing? She wants to know how you're doing.
Oh,
And I would have just come back from a bike ride,
yeah.
and
Yeah.
I'm like, I'm doing fine.
Yeah.
She unfortunately didn't make it,
Yeah.
but I think that was the guilt part for me
Yeah,
was,
Yeah.
survivor guilt.
yeah,
Yeah.
yeah,
Yeah.
I didn't have to have chemo and
Yeah.
because my oncotype was 17
Yeah.
and I didn't have to have radiation, but that was because of the path I chose
Right.
to have a double mastectomy with aesthetic latch closure. So I was basically I want to do whatever is the quickest thing to
Yeah.
get me back on the
Yeah.
road. And I'm okay with that.
Right. So you chose a plan that fits well for you. It may
Mhm.
not fit for somebody else. So
Right.
everyone needs to make their own decisions with their physician, depending on where they're in their life and what path they want to choose.
Right.
And I'm sure Dr. Cripe told you there's no survival benefit with a lumpectomy versus a mastectomy.
Right.
And for the lifestyle that you wanted to lead, this just made sense to you. So you don't have to go get radiation because typically women who have a lumpectomy need radiation after
Mhm.
surgery.
And I didn't do reconstruction. I told him that right off the bat too.
I think that was another good point in the book too, talking about like what's important to you.
Mhm.
And so you even said right up front, all right, I want to be on the road. I want to travel. My breasts aren't important to me. I'm done breastfeeding my kids. I want to go travel. And you even talk about you and your son talking about your breast and how odd that
That
was.
was odd.
Yeah.
Yeah.
But I think that's good.
30-year-old,
Yeah, but it's healthy to talk through it and then find out again what you want to do. And I think when you came in right up front, you're like, okay, put it on the table. I know what I want to do. I want to go travel. Let's get going.
Yeah.
And for some people, they don't know what they want, or they maybe can't verbalize what they want. And so one thing that I think is important as a physician is to be able to draw out of that person what they want, even if they don't know. So to ask certain questions to find out what's most important to them. And so for you, after going through a mammogram and getting a call back when you're in another state and then not being able to get the ultrasound that you were prescribed, like different challenges you had,
Yeah.
I think went into then you choosing, so, okay, I don't want to go through this again
Mhm.
with mammograms and images and therefore doing the double mastectomy versus someone that lives here and goes to the same imaging center. It might be,
Right.
it's going to be a lot
Right.
different for them.
Different.
I
yeah.
probably would have picked a totally different path
Right.
had
Yeah.
I not been doing the lifestyle that I have.
Yeah. And that's what's important though, for you, different than somebody else. So I thought that was great.
Yeah, that's a really great point. Do you have any regrets?
Only that I didn't lose about 20 pounds.
Yes, yeah.
Don't we all?
That's true for all of
That's
us.
the only regret.
Yeah, yeah. And did you feel like you were prepared for the surgery that you wanted to? go through?
Yes. Yeah, I mean, I had talked to my cousin before he called me to tell me that I was definitely, that we all knew. And
Part of your homework, right?
my homework, yes, I
Yeah.
had homework
Yeah,
that I needed to talk to because my one cousin had breast cancer, but a long time ago. It was based off of other things, and so wanted to make sure that they'd had the BRCA test, the genetic testing, and they did. Well, her older sister did have it, and she is also a nurse. So I had talked to her, and I, that first night, and because, I mean, I went in on Monday morning. I had the ultrasound. No, I
Mhm.
had the mammogram, and then I had the ultrasound.
yeah,
And then I met to the nurse navigator, and she said, okay, this is what's going to happen this afternoon. You're going to meet with Dr. Cripe. We all love him. She did
Yeah.
say that. You should give her a raise.
I'll have to do that.
And then you're gonna have the biopsy. So all in the same day.
Yeah,
And so then I went home.
it's overwhelming, isn't it?
Yes.
Yeah,
And I went home in between and I called my daughter. I'm like, can you come this afternoon and meet us at Dublin Cancer Center? And actually, when I first called to make the appointment and it said Dublin Cancer Center, and I was like, okay, this is serious.
Yeah.
You know, I was expecting Ohio Health Radiology. I really was. And so my daughter was like, yep, I'll meet you there. And, you know, so we took care of all that. And I talked to my cousin that evening and she said, this is what you want. You don't want reconstruction. You just want to take them both and be done with it.
yeah,
And I said, I mean, I didn't even know. Honestly, I had no idea what a mastectomy was.
yeah,
Hmm.
yeah,
And so then later, my husband and I said, we need to look at some pictures just so we're prepared.
yeah.
And we did. And I mean, it helped. You're still not totally
Right.
prepared, but,
Right, yeah.
but it did help.
Yeah. So making sure you're educating yourself before the procedure,
Mhm.
asking questions. I say talking to people that are reliable because everyone will have some story that, or someone, they know someone who had this surgery or that surgery. It may or may not have gone well, and then it can scare you too. So I think it's important for audience to know, it's important to gather your information, but make sure your sources are reliable
Mhm.
and talking to people that actually have good knowledge about it.
Yes,
And
because they told me don't Google anything.
yeah, Dr. Google did not go to medical school, so that's typically what we say.
So I did not Google anything.
Yeah. You know, you said earlier that you felt guilty because this other person at your RV camp, you know, ended up having the cancer come back and you had it easy and you didn't. You went through a double mastectomy.
Mhm.
You took a medication to shrink down the tumor prior to surgery. Not that you needed to do that, but because of your lifestyle, you chose that, right? Do you want to talk about that a little bit?
Sure. You know, when we met with him for the follow-up, just to go over the flow chart that he had, that was so helpful. And I think that's important, that doctors have something that like the patient
Visual
can sit
aid,
there and
yeah.
visually say, okay, if you do this, then this, at this, then this kind of thing. And then when he said I was going to be on anastrozole for 5 years and keep going through menopause for
Mhm.
5 more years, which
Yeah.
I was not happy about. You know, I thought, okay, well, it is what it is, and I have to do what I have to do. And I really didn't have any concerns about it. I mean, I do have some side effects. I've been on it for a year now, and I do have some joint pain and that kind of, but it's nothing worse than what I'd had before.
Okay.
So I'm not really concerned about that. I know that there are some people that I don't want to have to take another drug or whatever, but if it's going to help.
Yeah.
then
And we
I'll
have a
do
number
it.
of studies that show that
Mhm.
medications help decrease the chance of cancer coming back by 50%. It does have side effects, but there's so many things we can do. So it's important to talk to us.
Mhm.
And that's another reason that I put this podcast out, because we talk about different things. I created this Finding a New Normal series, which is truly not new normal, but you know, we talk about body image issues, hot flashes, sexuality, fear of recurrence. These are all the things that women go through once you've been told you have cancer. So there are things you can do to help yourself
Mhm.
with the side effects.
Mhm.
And going back to what you were talking about, I think a little bit, you wanted to go to the beach. And you
Mhm.
said, all right, that's really important.
Mhm.
And then from our standpoint, we typically try to get people to surgery around 30 days is kind of our goal from
Yeah.
diagnosis. So when that beach trip was going to push us out beyond that 30 days, COVID taught us, and I think our European colleagues have taught us a lot about doing the neoadjuvant endocrine therapy, or starting that pill first for a month, 2 months, 6 months, a year, whatever it is for people. But if you have a trip planned or a family vacation, that's really important. It's like, all right, let's have you meet your goal, get there. And so let's start treating the cancer right away with a pill. And then you go have the beach trip, and then you come back, we do surgery. So I thought that was a good way
Yeah.
for you
Yeah.
to make sure that you're meeting all of your goals and objectives
Yeah.
while still treating the cancer and not just putting it off.
Yeah.
Yes.
There are some good things that came out of COVID, and that being one of
Yeah.
them for us in breast cancer world,
Right.
for sure.
Mhm.
I want to hear about the drains
Yeah.
after surgery.
You want to hear about them?
Okay,
Yeah,
so
yeah.
I will say I've had drains for 6 weeks
Yeah.
myself, so
Oh.
those are not my favorite things either. But
Thank goodness I didn't have them that long.
yeah,
I had them 2 days longer than I wanted.
yeah.
They weren't bad. I mean, other people, I've seen where people are like they're the worst thing in the world, and they weren't the worst thing in the world, but I wasn't happy that I had
Yeah.
to keep them 2 extra days. But then when he said, "Well, I'll take him out today, and you can come back tomorrow, and I'll stick a giant needle in your chest," I'm like, just
All right, I'll wait 2 days.
just keep him in
Yeah.
2 more days.
Yeah.
But my husband helped me with doing all the stuff for them and
Yeah.
everything, and I had the safety pins, and I had the big oversized men's shirts, and I tried to do a field trip once. I think that's in the book. I don't know if I put that in the book or not. But our washer died in the middle of all of this. That story is in the book, and so we had to have, it was a possessed washing machine that came back to life while we were at the beach. And so
You also wanted to go to the beach.
it
though.
wanted to go to the beach.
Yeah.
So we ended up getting a new washing machine, which was going to be put in like 4 days after surgery.
Mhm.
So we had to go pick it up, and my husband, that morning, I think it's like day 4 after anesthesia, I just was ready to just cry,
Mm.
and I hadn't cried at all.
Yeah.
But that day I was just like really teary, and he said, "Well, just, go with me to get the washer at Camping World." And I mean, I'm in like, capri sweatpants and the big oversized shirt and all the stuff. My hair's wet, and I went, and so we go into Camping World, and I had to go to the restroom. And so I'm just like slowly making my way to the restroom. This long lady, she's like, "Can I help you?" I'm like, "I just need to go to the bathroom." I'm just like, "Are you okay?" I'm like, "Yeah, I'm fine." And that was the last time I went on a field trip until the drains came out.
Yeah, yeah.
'Cause I was like,
Yeah.
never mind. I'm okay.
Patients that typically will say drains are the worst thing. And when we hear that, we're actually happy. And not to be facetious,
No.
you're happy because if that's the worst thing that's happening to you
Right.
right now, that's not a bad thing,
not a
right?
bad thing.
It's a temporary thing. It's doing what it needs to do. It's removing the fluid that the body makes when the breasts are removed. So it's doing its job. So if that's what the
Mhm.
worst pain you have, you're fine, but you're going to be
Yes.
okay.
I didn't really have a lot of pain. I had memory lapses because of the tramadol, where I apparently
Yeah.
had talked to people on the phone and don't remember talking to them, that kind of
Wow.
thing.
Yeah.
Yeah, really.
Yeah.
Interesting.
Yeah.
So,
your the take-home message from your book is don't wait. And you talked about not waiting and listening to your body, making sure you're getting your screenings and, seeing the doctors, making those appropriate appointments. Even though you're doing this RV journey throughout the country, you made time for take care of yourself.
mhm.
And that's what I want our audience to take home. I really liked the story about your aunt. It actually brought tears to my eyes.
Wow.
Do you want to talk about that just a little bit? There was another don't wait moment.
It was another don't, yes.
Yes.
That was a podcast. That was a blog post I wrote.
There was a blog post. I believe,
Yes.
did you not talk about this in the book?
I don't think I did.
I don't think
Okay.
so.
Okay.
That's new to me. So.
Oh,
Yeah, so-
okay.
Yeah.
I did read.
No.
I did read your blog.
She read
So
my blog.
yes, I did read your blogs. Yes.
So my aunt used to work for a book publishing company in New York, and she was my mom's younger sister. And so one don't wait moment I had, she and her husband had moved back to Ohio, and I was up visiting my mom and my stepdad, and I just started processing how I was going to write the first book and what the story was going to be about. And I got an email from Panera that I had a free bagel. So I went to Panera, and my aunt and uncle were there, and I wasn't planning to see them that trip. So I sat and had breakfast with them and told her I was gonna be writing this book. And she said, "Oh, I want to help you with it." She said, "Probably anybody that I would still know in the publishing world is dead by now, but whatever I can do to help, I'll help." And so I thought, "Oh, this is great." Well, she hugged me at the end, and I have 21 cousins. And she said, she's the youngest of 6. And she said, "My purpose is to keep all of you together when all your parents are gone." And so 2 weeks later, I got a call from my mom, thinking it was about my stepfather who had Alzheimer's.
Hmm.
And she said, "It's not Bill." She said, "It's your Aunt Jetta." And I said, "What happened?" She passed away in a car accident
Yeah.
Oh,
that
wow.
morning.
Yeah.
And so if I hadn't gone to Panera, I wouldn't have seen
You'd
her.
not have seen her.
And so then at the funeral of the 21 cousins, 20 of us were there.
Wow.
One was in Florida and couldn't make it back. But
Wow.
I said to them, I said, she wanted us all to be together, but I don't think this is what she
Hmm.
meant.
Yeah. Yeah.
And so,
And
yeah.
I thought that was a really great story in not waiting because, we're our lives are not guaranteed. The next 5 minutes, we don't know what's going to
No.
happen, right?
No.
I think it's important to listen to that intuition, if you will, or maybe God talking to you and
Mhm.
telling you, go to Panera's, maybe,
Mhm.
So we just don't know what the bigger plan is. But what I did want to tell you is you're keeping her legacy alive by writing books
Mm.
and talking about her story, because that's going to help other people.
Mhm.
Stories like this, I often see that it gives other people permission to be vulnerable, to come out with their own stories. So then you don't feel so alone, right? Like it's all
Mhm.
about when you get told you have breast cancer, you just think, I'm the only one going through all this, right? Did you ever feel that way?
I write
Mm.
that in the book.
Mhm.
I wanted this to be my disease and mine alone.
Yeah.
Mhm.
And then when I put it out on Facebook, everybody had it,
Yeah.
including two friends of mine at the same time.
Yeah.
Were diagnosed within weeks of me. And we
Yeah.
all did different, we all have the same type, but we all did different paths.
Yeah.
And oddly enough, I used to teach in a preschool, and out of 20 women, 5 of us have had breast
Wow.
cancer.
Yeah. Yeah, Dr. Cripe and I, we talk to our patients. 1 in 8 women will get
Right.
diagnosed with
Mhm.
breast cancer, and it's actually very prevalent. It's a very
Yeah.
common disease. It's not a life-threatening type of disease. Cancer word is scary,
Right.
but most common cause of death for us women is still heart disease, and we still need to take care of ourselves in terms of exercising and
Mhm.
taking care of our bodies physically, mentally, emotionally, spiritually. And so I think, you talk about that in your book, which was very good.
Mhm.
All right.
Okay. All right. So Jennifer, I did want to talk to you about when you're first diagnosed, did you go through the stages of grieving, which is like the denial, the anger, the bargaining, depression, acceptance? Did you go through those stages?
I didn't.
Yeah.
Oddly enough, I don't know
Yeah.
why.
Yeah.
I think I just was so focused at that point on figuring out where we were going to stay, figuring out how, all of that part was going to work.
Yeah.
How I was going to tell, not so much the kids, because I called them right away when I read
Yeah.
it on my chart, even though he hadn't called me yet, but they warned
Yeah.
me that it would be on my chart, and then I
Right.
would get notification. And of course I looked.
Yeah.
So I would be prepared for when he did call me. That
Yeah.
helped actually, to know ahead of time. And so I really, throughout the whole, because then I was busy trying to get us moved and trying to go to the beach and before the surgery. And I never really went through any of that. I'm not sure why.
Hmm.
But I just I never felt depressed.
Yeah.
I was just like, okay, this is another part
Yeah.
of my life. And
Matter of fact, this
yeah,
is the next
I
thing you
think
have to do.
that's kind
Yeah.
of, yeah.
Yeah. Yeah. And I think it's good to have that. Now, did you ever get emotional afterwards, after the surgery was completed and as you're going through healing phase?
Only like 4 days later,
Okay.
I felt like I could just cry all day long.
Okay.
And that was the only day. And then that went away. And even, well, when I took the bandages off the first time when I was allowed to shower, Mike and I both got a little bit
Yeah.
emotional. And then it was just like, okay, let's get the shower over with because I'm tired and I want to go sit back down.
Yeah. Yeah.
But I had to find it. Living in an RV, how do you recover when you have to, you can't lay down in the bed. So I had to sleep in a recliner for 2 weeks. So I was preparing how I was going to do that. Fortunately, we got really nice furniture, so it was
Yeah.
comfy. And making sure that we were prepared food wise and all that kind of stuff. So I really never had time to get too emotional.
Mhm. Yeah.
And I think being with my family and our grandkids,
Yeah.
with 2 little grandsons, that helped before just being with all of them and saying, this is what's important.
Yeah.
You
Yeah.
know,
And you talk a lot about nurse navigators,
Mhm.
how they helped you.
Stephanie was my nurse navigator.
Yeah.
She was wonderful.
Mhm.
And she actually read the book and
She's in the book.
she's in the book.
Yeah. Shout out to Stephanie.
Yes.
Good job.
Good job, Stephanie.
All right.
And so, if I had questions, I called her and she checked in on me after surgery was over. She checked on me before surgery to make
Yeah.
sure that I knew, walk through everything and gave me hints like go to the Goodwill and get some big men's oversized dress shirts. And then you can just throw them away when your drains are gone. And tips like that were really helpful. And then she would call me every couple of weeks after just
Yeah.
to make sure that that I was doing okay. And everything was healing fine. And I had to wear the ACE bandage for a whole month after
Yeah.
the drains
Yep.
came out.
Yep.
Yeah.
So I wasn't thrilled about that, but
Yeah.
But nurse navigators are a wonderful
Yeah.
part that we
Yes.
have.
yes.
And that's something as we talk about surgery, and we are just talking a little bit offline, that you find out you have an abnormal mammogram, and then you find out you have cancer, and then you find out you need surgery. And then right after surgery, it's okay, well, how do I recover from surgery? And then you're like, okay, now what do I do? And so the nurse navigators have just been a great addition to healthcare, I'll say,
Yeah.
because I'm spoiled the last
Yeah.
I
We
don't
are both for
24 years. I haven't
Yeah.
known anything different. So we've had nurse navigation for a long time, which is awesome for breast cancer patients. Not all cancer patients have that. Not all
Yeah.
breast cancer patients have that, but just someone you can call and talk to
Mhm.
Yeah.
that's not at the surgeon's office or the medical oncologist, but it's just like it's your own person, and they'll call and check in on you. But that's, I think, very helpful. You talk in the book also about some of the questions you had and some of the phantom pain, and
Mhm.
even when you had tightness. Tell us a little bit about like some of those experiences after surgery was done and the drains were out and all that happened.
So you had already set me up for physical therapy, which was wonderful. And Tressa was her name, and she was great. And so she helped me with figuring out, what massages to do to loosen everything up. And we figured out you could get one of those little facial rollers and just to roll as I'm sitting around watching TV or whatever, just to keep everything loose.
Just not out in public, right?
No.
You talked about your husband. Make sure to, if I,
I wasn't doing out in
yeah,
public.
yeah, don't do that.
Make sure I'm not massaging myself. in
You're
public.
right.
Yeah.
Excuse me. But yeah, so I think that just being able to have physical therapy, she worked with me on using the kinesiology tape to flatten out the scarring, and exercises that I'm still doing to this day to make sure everything stays loose so I can raise my arms and just work with the tightness. And so those kind of things are so important to recovery, I think, as well.
Because lots of times all the active treatment happens and we're all focused on the active
Yeah.
treatment, and then you get done, you're like, all right, where'd everybody go?
Yeah.
For people getting chemo or for people getting radiation, they go in and
Right.
see the same faces for so long. And then all of a sudden when it stops the active treatment and you're kind of by yourself, or for you, maybe you're by yourself in an RV
Yes.
and, Glacier National Park or somewhere, like, who do you call? Who do you reach out to? So I think the nurse navigators for us are invaluable resources that you can call. They call you, and getting you plugged in then to say, okay, you have physical therapy. So we've started now prehab. So seeing the physical therapist before surgery to find out any limitations, but then after surgery, once that healing's completed, 4 to 6 weeks, starting to do some more physical therapy. So having that in place is wonderful. For people that don't have that in place, making sure you can reach out to someone to get the physical therapy, to get moving and get active, and understand that it's normal to feel kind of that tightness. What'd you call it? An iron?
Well, I felt
Shirt
like I
or-
was wearing a tube top made for a 3-year-old.
A little tight.
Yeah. Yeah.
Tight. Still
Yeah.
a little tight,
Yeah.
but yeah.
Well, this goes to show, a medicine is not like it's a team sport. So
Mhm.
it's not just Dr. Cripe, but then there is physical therapists involved, there's nurse navigators, there's radiologists, there's pathologists. And imagine Dr. Cripe is prescribing your anti-estrogen medication. Sometimes there's medical oncologists, whether you're getting chemotherapy or not. So it takes a whole team of people.
And there's Dr. Hala Harvey.
And
who
and there
also
was me,
helped
yes,
for-
yeah.
That we
yeah.
both operated.
Yeah,
on Jennifer.
which will be a segue to our next segment is we do double mastectomies together, and we'll talk about that in the next segment coming up here. But yeah, and we'll talk about how that has changed us as a result of us working together. But I also want to touch base a little bit about survivorship. So Dr. Cripe has touched on when your treatment is completed, you're standing at the edge of this cliff. Everyone has left you, so to speak. In your case, for
Literally.
real, literally, everyone has left you. You're by yourself, so you're looking down. So what do you feel?
I didn't really feel lost. I didn't feel like I was like left behind. However, I will say, because I'm not stationary, I don't have like the whole survivorship program.
Yes.
Right.
That other people can go somewhere.
Yeah.
To, talk to other women, other survivors or whatever. So that piece of it, I do not have.
Yeah.
Did not have. Um, I am only on one forum, and it's on Reddit, and it's a breast cancer forum there, and it's been phenomenal. I'm on one Facebook group about aesthetic plaque closure, and that's been good too, because women are sharing pictures, which I'm not comfortable with, but that's okay. And so we kind of can help each other through different things, because a lot of women don't have that survivorship
Yeah,
program
yeah,
that I could have had at
Yeah.
Ohio Health, but it stayed
Yeah.
local.
I just recently listened to a podcast on Navajo Indians in Arizona. The medical care is so restricted. One third of the population don't have electricity or water,
No,
and
they
that's in the
don't.
United States.
Mhm.
And I kept thinking of them as I was reading your book. I was thinking, gosh, like there must be so much disparity of care. They don't have a cancer center to go to. They don't have providers who actually work there. So I kept thinking, I wish like, there is a program for them out there where there's virtual things like support groups and things like that exist. You do have to be careful with the Facebook groups, because sometimes people
Mhm.
will talk about the worst thing that's happened, or,
Mhm.
share pictures, like you said, some other people may not be comfortable with.
Mhm.
So what
Yeah.
else would you want our audience to know about as you're healing through this process? What are some things you wish you had known?
I wish I had known probably how I would be feeling physically
Yeah,
after, and how, like I said before, I have nothing blocking the view of my stomach anymore. So,
Yeah.
physically I do look different,
Yeah.
trying to find clothes, those kind of things. I do have the prosthetics. I have yet to take them out of the box,
yeah,
and I'm okay with that. I got them because insurance paid for them.
yeah,
And, if I ever need them, they're there.
yeah,
If I'm wearing a nice dress or something, but
yeah.
that's not something that I do a whole
You do
lot.
very often.
It's not in your closet, not in your RV closet. You have one dress. Yeah. Uh-huh.
Yeah,
And
Yeah.
actually, I wouldn't even need them for that one dress that I do have.
That's funny.
But yeah, so I think that's probably, the physical aspect of it. I wasn't quite ready for.
yeah. So the body image issues, if you will,
Yeah,
you do have.
yeah.
And I do have a segment on body image issues on the
Mhm.
breast cancer
I
podcast.
listened to it.
Did you listen to it? What did you think of that?
I thought it was really good. I
Yeah.
think, because of the anastrozole that I'm on, and we talked about this at my last visit, the weight is going to be harder.
Yes.
And especially with our lifestyle, the weight will be harder because it's been hard. Because whenever we go somewhere new, we ask, okay, what is there to do there? And the first thing they tell us is where to go eat.
Yeah. With
Yeah.
the restaurants.
Yeah.
Yeah.
And, this has the best pie, this has the barbecue or
Yeah,
whatever. And so
yeah.
we try to limit ourselves.
Yeah.
Or if we're traveling, like when we came back to Ohio, we traveled 6 days in a row
Yeah.
from Colorado. And that was physically hard for me because we wanted to make sure that I got out and walked around about every hour and a half. Moving an RV every day, there's a lot to it, so it's kind of exhausting. So by the time we got here, I was pretty worn out. So just pacing myself, even when we were at Zion National Park with our kids, they flew out the end of March, and that instead of the beach, we did that instead. And they all came to Zion. By day 4, we had done like hiking every day.
Wow.
And by the 4th day, they were doing a hike that I'd already done. And I knew it was going to be a hard one. And I said, you know what, time out.
Yeah.
I need a break.
Yeah.
So that to me, and that happens to me probably once or twice a month.
Yeah.
I'm just like, okay, I need a break.
Yeah. I think it's important for audience to know if you're taking anti-estrogen medication, it can cause fatigue. You do have to pace yourself. I think you do have to schedule your activities for the day with some little bit of a break. You
Mhm.
really can't do things that you're once used to doing, whether you're having joint pains, tiredness, just fatigue in general. But I think that's really smart to know when you can and you shouldn't do it,
Mhm.
and at the same time being active
Right.
and not be sedentary. So
And give yourself permission to take a break.
yeah,
Right.
and it's
So many
okay.
people say, "Oh, I got to keep going. I have to go. I have to
Yeah.
go." And it's like, no, it's okay. Give yourself permission.
Yeah.
You can take a break. You can take a day off.
Right.
You can read a book while they go off
Yeah.
and do something.
And I mean,
think
that's
good.
when they knew it was really, okay, mom really needs a break, because I was be missing, the last day of fun with
Yeah.
my family.
Yeah.
But I was able to rest, and by the time they all got back, then we had a great afternoon and
Yeah.
evening.
Yeah,
that I
that's
wouldn't have
wonderful.
had,
That's
so.
good.
That's wonderful. What else do you want to tell our audience? This
Mm.
goes to 115 countries, so not just in the United States, it's outside the country.
Yeah.
So if you have something that you want to do, no matter what it is, don't wait. I mean, you just never know, what the plan is for you for tomorrow even. And it's just important to live your best life
Mm.
and take care of yourself as best you can. Sometimes it's not always easy, but just get out there and live your life.
Yeah,
And be an advocate for yourself as
Yeah.
well.
yeah.
That helps.
Advocate for yourself.
Yeah, be an advocate for
That
yourself. And I'll
helps.
also add to find physicians who listen to you.
That is so
And
important.
Dr. Cripe created this personalized plan for you, which is what you want, a doctor. It's not
Mhm.
one size fits all. It's trying to figure out a plan for you that fits you for you in your life with your goals. And we both always say quality of life is important. So
Mhm.
it's important for us that you still live your life, go to the beach, go to the, RV, the park that the National Glacier Park that you talked about. Those things are all important. Whatever is important to you is going to be important for us, and we're going to navigate through those things. So
Mhm.
find doctors who listen to you, and if you don't feel comfortable with the doctors, find a different doctor.
Mhm.
So I think that would be my take-home message for me as a physician is listen to patients.
Listen to patients.
Yeah,
Mhm.
100%. So
This is great.
this has been really great. I
Yeah.
want to tell our audience, don't wait. Go get this book, and it's on Amazon. I'm going to put the link in Amazon as well. Do you have any other places
No,
that?
just
Okay.
Amazon.
Okay,
Right.
so I'll put it in my show notes, the link to Amazon for this book. It's very inexpensive, lots of good take-home messages. And as we go through life, as we're navigating through life, we have ups and downs. And it's important to not wait, listen to yourself, and make yourself your own advocate. So I really want to thank you, Jennifer
Thank you so
Skinnell. Thank you
much.
so much for taking the time to be on our show today. So,
Sure. Thank you.
Thank
all right.
you.
Until next time, see you later.
Yes.
Bye-bye.
Bye.
Thank you, everyone, for tuning into the Breast Cancer Podcast. Remember, you're not alone in this fight. I encourage you to be an active part of this podcast. Please share your stories, questions, and suggestions for future topics at my website called drdeepahalaharvi.com. And please share this podcast with others, especially if you found it useful. And please also give it a 5-star rating, if you will. Stay connected as we navigate the complexities of breast cancer. Until next time, take care and keep shining brightly. Disclaimer: this podcast is not intended for complete medical advice.